When you set up a temporary clinic in a village, you're just amazed by how many people arrive. And it's amazing how they even know that there's going to be a clinic held and how quickly word spreads. Many of them walk days. You see a lot of wounds from working in the farms, a lot of foot injuries from children who have no shoes. And some of these with just simple antibiotics would have been treated, but have progressed to become major wounds that are now very difficult to treat. We had a little boy who had been stung by a bee several weeks prior, and he had edema in his entire body and internal organs. And the poor child, his head just blended into his shoulders like a tombstone. We were able to transport him to a hospital, and he did receive treatment, and it looked like he might improve, but he did eventually die. And it was so tragic because it could have been prevented very easily and very inexpensively. Providing healthcare in remote areas is always such a challenge. The most frustrating challenges are those which could so easily be overcome by simple technology. In Ghana, where we're building remote clinics, for instance, patients present at more than one clinic, and coordinated medical record keeping becomes nearly impossible. Plus, only the district hospitals have a physician on staff, and the supporting clinics have almost no means of accessing that physician for advice. So we started to look for ways to solve that problem so that we could identify the patients and that we've seen before and see what information we had on file for them. As part of another project we designed, the local hospital in our district and several community clinics now have computerized biometric-based medical records, but the lack of infrastructure still prevents the sharing of information between healthcare facilities. Unreliable communication, including internet connectivity, means millions of people in places like Ghana and most of sub-Saharan Africa live without the promise of profound change offered by cheap technologies available right now.
I like challenges. I mean, Gabriella brought me a challenge. She said that there are things that can't be done. And I was like, no, they can be done. We just have to use different resources. And, if there's a problem, there's a solution for it. We just have to look for it. So it reminded me of a college issue that I had when I lived in dorms and I wanted access to the college Wi-Fi, and I couldn't do it because I didn't have, I was too far away from the main source. So I came up with a way to use a little homemade parabolic antenna, and I was able to get internet like 10 miles away from college. But then I ran into issues where the complex I was in, they wouldn't let me put my parabolic antenna outside the complex. I couldn't attach it to the wall, so I put it on a little helicopter, a little toy helicopter, and I was like, okay, I'll just fly it.
So, it's our intention to connect our remote clinic sites with the local hospital and available physicians by designing and deploying our own network. We'll use available, highly directional parabolic Wi-Fi antennas. We'll install them in new and existing towers, and when those aren't available or practical, we'll use what is, an abundance of tall, isolated local trees called wawas.
We spotted a few towers, and we're going to work with the cellular companies there if they'll give us permission to use existing towers. And if we can't, then we've got options to use lumber or metal to build a tower. And if that doesn't work, or if that's cost ineffective, we can always go with a tree option where we can use an existing tree. I mean, you just got to think outside the box. Bottom line, it all boils down to money.
The creative use of this simple, proven technology will allow us to immediately provide better health care, continue to identify disease and treatment patterns, allocate supplies, and connect those with the most need to those with the most to offer. What's incredible about this system is that it is a very simple solution to a very large problem, a global problem. The biometric system allows for better patient care through better patient records. It also allows for improved community health through effective vaccination programs. It just takes some imagination and a little money, and it's ready to go right now.